Most men with ED never check this vitamin, and this one can directly affect erection strength. I'm Dr. Debra Durst, and I specialize in sexual wellness. And today we're going to talk about vitamin D3 and your erections. So let's get into it. What is vitamin D3? So D3 is actually a prohormone, not just a vitamin. And so this affects lots of functions in the body. So it's super important to have this vitamin optimized. And if this isn't one you're taking, or you don't know what your level is, then that is something that I highly suggest that we start with getting a level drawn. So basically, it can affect testosterone production in the body, can actually affect endothelial function, which is the function of your blood vessel, and also nitric oxide production. And so it's super important for even that signaling. And so if we're talking about vitamin D, basically you have in your skin cholesterol that has UV light, and the UV light interacts with our skin, and then we form vitamin D3. There's multiple metabolites. It does involve the kidney and the liver, so that you can get an active form, which is 125 vitamin D3. So 125 vitamin D3 essentially. And then that is the active form, but it is a fat soluble vitamin, so it can be stored in fat. And so just know that there's water soluble ones. This is one that you would want to get your level checked, because if you did take too much, potentially you could have an accumulation and it could be too high, but that's a pretty odd scenario. In fact, it's pretty rare to have vitamin D toxicity. You have to have a level greater than 150. You have to have calcium alterations in the body at the same time. And so optimal levels that we're going for are usually 80 to 100. And sometimes our patients will come in because their family members or the physician has told them they're too high, but they start to get nervous about it anytime you're over 30. But like under 30 is a critically low level, in my opinion. And the ones that got really sick with COVID had levels that low. And then you're talking about 80 to 100 being the optimal level that we want. And that's a 25 vitamin D3 that we're measuring. In that one, you want 80 to 100. So you want to take any of your vitamin D3 with K2. And the reason that's important is because it helps get the vitamin D3 and calcium into the bones. And then it also keeps them out of arteries. So K2 is super important to take with D3, and most of the professional medical grade supplements have those two products in it. And it's really K2 that you want in it. And you don't want to take that separately. Yes, there's an MK7 that could be a longer acting K2, but you really don't have to worry about that if you get a professional grade like a Metagenics Designs for Health. Those already have K2 in them. And so a lot of our patients are on, 5 to 10,000 a day to keep their levels up. And we'll do shots in the office to kind of load them up and keep them, in that optimal range. But we do check in on a regular basis. And if it reaches 100, we're usually kind of dialing that back. But we do check that on every 3-month basis. What it does to support erection quality is that it'll increase flow. It helps with endothelial dysfunction or endothelial function and improving it. It actually helps with nitric oxide signaling, which is also going to increase your blood flow. It can help with testosterone production. So that's super important too. But just think vitamin D3 has benefits for potentially anti-cancer benefits in the body, but definitely anti-inflammatory and healing. And vitamin D3 at the time of surgery is also super important for your post-op recovery. So just know we've done previous videos on that, and I plan to do another video in the future about just how important it is to check your vitamin D3 if you're having surgery. So let me know if anything else on vitamin D3 you might have questions about. Again, what is the dosage? Typically, you're looking at international units, so you'll want to look at your product. But before you go and you optimize your vitamin D, you need to have a level drawn. You need to know where you are, what your baseline is, and you want to optimize but not overshoot. But it is important if you want stronger erections, because it keeps those blood vessels healthy and it keeps your hormone and nitric oxide working. And so let me know if you have any other questions, and hopefully this helps recognize the importance of vitamin D on your erections.